we have Monument Health, who is our, there we go. We can see them now. So we are very excited. All right, Monument Health team. We can see your smiling faces. We are so excited to hear from you all today. Let's give quick introductions before we get started. So I will let you all three, you're all in the same room. So whoever wants to go first.
Yes, hello. Thank you for having us. We are Monument Health. We're in Rapid City, South Dakota. My name is Tara. I am one of the nurse managers on orthoneurosurgical.
I'm Anna. I am also one of the managers on the orthoneurosurgical floor.
And I'm Kelly. I'm the nurse manager for medical and oncology.
And we have a presentation for you guys, so we'll get this going.
All right. Well, Tara, Kelly, and Anna, we are excited to hear from you guys. We have Monument Health back on. There was a lot of interest in Monument Health. So if you're watching from around the world, they are doing an amazing job here, and I'm excited for them to share all about their facility and all about their hospital. So you guys know the drill. There is 10 minutes on the clock. Ready and go.
Okay, so we'll go ahead and tell you a little bit about our facility. Monument Health, Rapid City, South Dakota. We're on the west side of the state, right in the middle of the nation in the United States. We're considered Midwest and rural community. We serve a large area. We'll let our video tell us a little bit about our facility here first.
Monument Health is headquartered in Rapid City, South Dakota, nestled in the beautiful Black Hills, in a place characterized by over 5 million acres of forests and mountains, an oasis in a sea of prairie. The system offers care in 33 medical specialties and serves 20 communities across western South Dakota and eastern Wyoming, serving a population of over 428,000. Over 4,500 committed physicians and caregivers live by our mission to make a difference every day. Monument Health is comprised of 5 hospitals, 8 specialty and surgical centers, and more than 40 medical clinics and healthcare service centers. As the only member of the Mayo Clinic Care Network in South Dakota, Monument Health physicians work with doctors worldwide to solve complex medical challenges, complementing local expertise and keeping our patients close to home. Cancer care, heart and vascular, orthopedics, neurosurgery, general surgery, and urology are just a few of the specialty services offered to our region with leading-edge technologies and treatments. Careers begin and flourish at Monument Health. The Rapid City Hospital is a Level 2 trauma hospital with one of the busiest emergency departments in a 3-state region, seeing over 50,000 patients. Rapid City Hospital is also a Level 3 neonatal intensive care unit, caring for our smallest patients. The Black Hills location and culture is a dream come true for emerging physicians and their families. This area draws entrepreneurs, retirees, and business leaders seeking quality of life. From the northern to southern hills, the rich history, abundant natural beauty, and adventure draws artists, entertainers, and tourists from all over the world. Those who move here call it stunningly beautiful, with endless year-round outdoor activities. With hiking and biking trails 15 minutes away, a lunch hour can turn into an adventure. Numerous lakes allow for boating, and the National Forest and trails are a mountain biker and UTV owner's dream. In the winter, many enjoy the local ski resort and take advantage of cross-country skiing and snowshoeing. Trees, trails, lakes, snow, climbing, biking, hiking, and fly fishing, it's all here. Public and private schools serve every learning style from traditional to expeditionary. Home to Mount Rushmore, the Badlands, Custer State Park, Spearfish Canyon, and more. And the rest of the world is only a flight away through Rapid City's regional airport. Monument Health invites you to make a difference every day. Visit our website for more information.
Okay, great. Hopefully that is still working. Let me
make a difference every day.
There we go. Okay, sorry, we are having a few technical difficulties this morning, but we have a great mission, vision, and values in our organization. We've really simplified things, and our vision is it starts with heart. We want to be one team, listen, be inclusive, and show that we care to do the right thing every time. Our values, we have 5 values of trust, respect, compassion, community, and excellence. And our priorities are to deliver high quality care, provide a caring experience, be a great place to work, impact our communities, and be here for generations to come. So again, we want to make a difference every day. So we are the largest healthcare system in Western South Dakota. We have 5 hospitals within our Monument Health system, 23 clinic locations, an assisted living and a care center. We have urgent cares and then specialty treatment centers like our Cancer Care Institute, Heart and Vascular Rehab Institutes, dialysis, surgery center, our behavioral health, and then we have an orthopedic specialty hospital as well. Okay. Go ahead and go to the next slide, please. Thank you. All right, our specialties, you can see we have a large list of specialties, and it also highlights there on the left for you that we are part of the Mayo Clinic Care Network. So that opens up a door with a lot of additional resources that are really great for our community, especially being rural, things that we may not have access to otherwise. Okay, so our hospital specifically that we are recruiting for right now is our Rapid City facility. It is our largest campus. We have 3 units particularly right now that we are going to talk about within our system. We're an over 400 bed hospital, our medical, oncology, and orthoneurosurgical units. So go ahead, next slide. Orthoneurosurgical, our area that Anna and I are over, we are very, very proud of. We're a 64 bed unit. We take care of all different kinds of patients, from our medical overflow to our orthopedic patients, our fractures and traumas and all of that, our joint replacements. Our neuro side, we take care of stroke patients, seizures, traumatic brain injuries, and we have a really awesome neurointerventional team now that are doing amazing things for our stroke population as well that previously would have had to have been shipped to another hospital in another state. So this is very exciting for us. Then surgical, we have a whole floor dedicated to our post-op surgical patients. We take care of everything from head to toe, many abdominal surgeries. We are currently working on becoming a bariatric center of excellence for our bariatric population as well. And you'll see everything, like I said, from head to toe on this floor. We have amazing ratios. We work with a 4-to-1 nurse ratio, and our nurse aides take an 8-to-1 patient to nurse aide ratio. So it's some of the best in the nation for our ratios and our ability to provide that care. We also are flexible acuity, so you'll see everything from our medical surgical level of care to our intermediate patient population as well, potentially taking those drips or needing that higher level, higher acuity care. But we have a charge nurse on every floor, and we also have nurse managers and lots of ancillary staff that are able and willing to jump in and help anytime. Okay, next slide. Kelly will talk a little bit about our medical and oncology areas.
Our medical unit is one of the units that has great ratios, anywhere from 4 to 5 to 1 for nurses, and then nurse aide ratio is anywhere from 5 to 8 to 1. We do have one of our pods is like a long-term care pod, so we get that kind of long-term care experience as well as med-surg and intermediate level of care. Patient population medical sees basically anything medical that you that patients come in for.
Right.
And then our oncology department is a 4-to-1 ratio. The nurse aide ratio is 8-to-1. We that unit is also a med-surg or intermediate level of care unit. Our patient population is mostly oncology patients, whether that be post-surgery from cancer or patients admitted for chemotherapy. We also do plasmapheresis, just a lot of different things that pertain to oncology.
Okay, so a little bit about our team. We have a really diverse team. We get together outside of work, within work. We do volunteerism in our community, but we love to have fun together. We have a huge population of international nurses already at our facility, from everywhere from Jamaica to Africa to Philippines, and we are very, very welcoming with open arms. We so appreciate the sacrifices that our international nurses make to come here and help us. So we want to help you to become part of our team, and our community is wonderful for our international nurses. We're a small town. We're very safe, and yes, thank you. We'll go ahead and read through our mission statement for you here to wrap up. But our medical, ortho-neurosurgical, and oncology department has come up with a mission statement to create a culture where all caregivers are fully engaged, feel valued, excel in contributing to our overall mission and goals of our organization. We will have values of teamwork, empathy, integrity, compassion, and quality outcomes while remaining fiscally responsible. Above all, we want our caregivers to feel like they've made a difference in the patient's life. So we hope that you'll come and join our team.
Well, thank you, Monument Health team. I know it's hard to sum up all of the amazing things that you have going on there in 10 minutes, but you guys did it. So thank you for being on today and sharing all about your facility and all about your state. You know, there's something that you said right at the end there that I was just sitting here and I was like, wow, that really blows me away. You said we really appreciate the sacrifices that our international nurses make. I think that goes to show just how much the Monument Health team knows and really truly values their international nurses. You know that it's not an easy journey to get there, and you really value the international nurses that have made the commitment to you and that are working at your facility. I know that you have a friendly, welcoming community. You mentioned some of the places that you guys represent in your international nursing community, and I know for a lot of our nurses who are watching, that's so important to them to know that they'll have that community when they come on the ground. So thank you for sharing that. That was really beautiful. A couple of other things that really stood out to me was that affordable cost of living that you have in South Dakota. Very, very amazing affordable cost of living. I don't think you mentioned this, but it's something I know about South Dakota. No state income tax. That is a huge benefit. I'm coming from California, so I would love to have that. So if you're an international nurse who's watching and you are thinking about what to consider, no state income tax, that's huge. I also love that video with the beautiful natural landscape. Looks like there's lots of outdoor activities, a beautiful community that you guys are growing over there. So thank you so much for sharing. Thank you so much for being on and for being our partners.